Started.
Great. Thank you, Davelyn. So, like she said, my name's Melinda Elliott. I'm the Lacan Region 5 team leader. Uh, Lacan is the Louisiana Citizens Advocacy Network. We're the advocacy arm of the Louisiana Developmental Disabilities Council. Every state has a Developmental Disabilities Council. I don't know if every state has an advocacy arm to it, but we're it. You can see on the slide that there are 9 of us. There are actually 10 LDH regions. The First Lady gets to cover 2 regions. Right there in the New Orleans area, they're smack dab against each other. So she covers both of those regions. We're in the middle, Region 5. Just like the Families Helping Families office, we cover Cameron, Calcasieu, Jeff Davis, Beauregard, and Allen parishes. We are waiting for here, like the end of this month, we're waiting for the Louisiana Developmental Disabilities Council committee meetings and full meeting to solidify our legislative agenda. We have been working on it all summer long because that's what it takes to be able to get information from, people like me and you and get it to go through the process to be able to decide. So these are real tentative, like general things that we have so far that came out of the ad hoc planning committee. Um, one of them is an increase in waiver rates and the direct support worker wage floor. People have been interested about that for several years now. We're waiting for the rate study to come out any second, from what I understand. So then, when the information, there was a national agency that did the rate study. When that information comes out, then there'll be more detail to this. But at this point, tentatively, it's one of the things that we're going to work on. Another one is create, amend, or add an emergency alert system specifically to individuals with intellectual disabilities. I'm sure you heard about the child in New Orleans that eloped, and it took a while to get the system to motivated to look for him. So we're hoping to get something that can make that happen a little bit quicker. There's more than one agency working on that, so we'll see what it looks like. And then directing districts to conduct functional, doesn't want to come out today, functional behavior assessments as necessary to ensure a behavioral intervention plan is in place before continued removal. It is in the federal law. We'd like to see something more consistent in the state policy. And then additional funding for Louisiana Rehabilitative Services. You might also know that agency as LRS. We want to ensure that all federal funding match is drawn down. Our state is one of the states that doesn't do that. So then money that was allocated for our state goes to a different state. Like I said, these are real tentative, general, 4 of them, general things. People can still make views and more information known during the Louisiana Developmental Disability Council and ad hoc meetings. If you join, it's free. If I know Wallace is wonderful. Davelyn is wonderful too. But Wallace already dropped the link for you to be able to join. You're agreeing to get emails. Um, we call them action alerts and information alerts. You're going to learn more about the system, whether it's developmental disabilities or education, special education, than you thought you ever knew. Of course, if you're in my region, I would be contacting you at times to see if you can make a call or send an email. Some people are going to have a impactful story about these legislative agenda items, and I can help you get it down, um, 2 or 3 minutes, get it down to impactful, and you can use that anywhere. And, we have several activities. And I could talk about Lacan forever, but if you need to find your Lacan leader, you can use that chart. You can go to the website that Wallace dropped for y'all to register, or you can call our center and we'll help you figure out who your person is. And yeah, I'm going to give it back to Davelyn.
Thank you, Miss Melinda. Again, is super important. If it's something that you're interested in, please reach out to us. I am grateful to introduce to you Kevin Guillory, who is an enrollment services manager, and Theo Hooker, who is an enrollment broker. They are going to take it from here and provide you with some information about Medicaid enrollment. Again, please put your questions and such in the chat, and we will get to those as we're able. Thank you both for being here and for your willingness to share this information.
All right. So thank you for having us today. You should be able to see the PowerPoint now. So my name is Kevin Guillory. I am the Enrollment Services Manager for Louisiana Department of Health for Medicaid. I've been with LDH since 2013, and I've been over enrollment services since February of 2024. So today we're going to go over the following items. First, we're going to talk about changing plans. We're going to talk about comparing plans, how you can do that for both medical and dental. We're going to talk about choosing a primary care provider. We're going to talk about managed care services and value-added benefits. We're going to talk about some upcoming changes to the enrollment process. And then we're going to go over some questions that we were sent. Some of those we worked into throughout the presentation. Some we have at the end of the presentation. And then we'll take any other questions that may be remaining at the end of the presentation. So now I am going to turn it over to Theo Hooker and let him introduce himself and get started on the first area of our presentation.
Hi, everyone, and thank you for joining me today. My name is Theo Hooker. I am with the enrollment broker team. I'm a project manager 1 for our team. I've been with Medicaid for 3 years, and I've worked with the third-party liability department and with the enrollment broker department. So today we're going to talk about just changing plans and how a member can change their plans. So a member can go online and change plans, and right now they can do that from October 15th, which is going on right now, through December 1st. These plans will take effect January 1st, 2026. And how you can do that right now is you can actually go to the My Plan at healthyla.gov. And then you can go to the Learn section, and then you can click on Change Your Health Plan for your dental or medical plan. And then whenever you do that, you can actually click the link to change your plan, and it will prompt you to input the member's information so that you can change your plan. So once we change our plan, we are actually going to want to talk about comparing our plans. And how we are going to do that is we're going to go to follow the link at the My Plan at healthyla.gov, and then it's going to be /compare plans. And then we can actually do this online right now, or we can actually do it through our app, which is the Healthy Louisiana app. And then to get this app, you can search for the Healthy Louisiana on the Google Play or the App Store. So whenever you go to the My Plan you can actually search here at the bottom for a medical or dental plan in which you want to compare them to. And when you are comparing plans, what it's going to do is if you search the medical, it's going to prompt you into looking up to our 6 managed cares. And you can start by clicking all the information down at the bottom for the read all the benefits and plan details. Whenever you click the read all the benefits and plan details, you can actually see the value add chart that will display. And here you can see the plan and the value added chart benefits, including dental, vision, adult wellness, pharmacy, transportation, pregnancy, quit smoking programs for vaping and tobacco, and other programs as well. Now, if you want to compare the plans side by side at the same box, you can actually select the plan, and then you can actually do the drop-down arrow, and you can select the additional managed care that you want to compare it to. You could do this just by clicking the View Basic Plan Benefits to view the basic plans. And then as a reminder that all medical plans for Medicaid do offer the same basic benefits packages. So now I'm actually going to let Kevin talk about dental for a few minutes.
All right. So a frequent question that we get is, do I have dental services with my Medicaid coverage? So for children under 20, children receive comprehensive dental coverage and general dental care through both DentaQuest and MCNA plans. So a child would either be enrolled or assigned to DentaQuest or MCNA for that coverage. For the adult waiver program, dental services are provided to some adults with disabilities, 21 years of age and older, who are enrolled in the New Opportunity Waivers Program, Residential Options Waiver, or the Supports Waiver Program. And the coverage for that program is very similar to the coverage that the children receive in terms of being comprehensive dental coverage. For other adults ages 21 and above, they receive denture coverage through MCNA and DentaQuest, and they may also have limited dental benefits through the value-added programs covered in the MCO value-add charts. And so for that, we recommend that you check the value-add chart, which we'll get to in a minute, and we'll also recommend that you check with your MCO for more information. And so I'm going to toss it back to Theo to talk a little bit about the value add chart. He'll go over a little bit of information about that.
Okay, thank you. So for the value add chart for 2026, we could go to the myplan.healthy@la.gov, and there's going to be a link for the value add chart there. So the value add chart is going to allow us to compare all 6 of our managed care organizations and kind of the value adds and what they have to offer. And if we're going to go down the line, we do have all of the phone numbers and the information, as well as the value adds that they have for, for dental, for adult dental, adult vision, for diabetics, and then the whole thing for adult wellness, child wellness. And then we're going to go over the counter medications. And then for some of the rest of the programs, like the pregnancy, the quit smoking program, the transportations, and the other. Now, in the other section, what we actually have is some of the value add plans. And so some of these value add plans are going to be some of the benefits that some of the different MCOs offer. So most MCOs do offer value added benefits to members for completing health related activities. And then most of these rewards can be used for over-the-counter products such as vitamins, medications, health aids, and bandages. And below are some examples of what some of the current MCOs do offer, and which these are on the other part of the value add plan. And some of the ones that we do find right here is like $25 for completing health needs assessment within 90 days of enrolling. And so for more information, members can visit the plan's value add plan, or they can actually contact the MCOs directly. So finding a primary care provider is something that we're going to actually talk about right now, and some of the benefits that we can actually use to finding those primary care providers. So to find this primary care provider, each plan has their own network of providers. And then we can actually go to the myplan.healthy.la.gov. And then here we're actually going to go to the choose. And then down at the bottom, it's going to be find a medical or dental provider. And it's going to take you to the prompt over here on the right, where members can search for a doctor, therapist, or specialist that is covered by their health plan, or it can be covered by all plans. It's what we'll see in the example. So what members could do is they can actually search up at the top. They can search by medical providers, behavioral health, or for dental. And then by our location, we can actually choose between a zip code, city, or parish, along with the location of miles. Now we can actually choose where it says the plan's optional. If you wanted to choose your specific plan or a plan that you are comparing, you can actually choose the plan that you were trying to find of who is in network with you, along with the provider specialties. So these specialties are going to include everything from general surgery, hospitals, transportations for non-emergencies, ambulance fees. And then if you wanted to search for specifics, you can search by a hospital or a specific site if you're actually looking for it. So an example of this was if I am looking for a cardiologist in Baton Rouge and I wanted to make sure that, it's in Aetna's network. So what I've done is I've clicked city, I've done it within 10 miles of Baton Rouge. And then for the plan option, I selected the Ambetter Health Plan. And in the provider specialty, I put the cardiology. And whenever I searched this and refined my search, I found that up at the top, you see it's displaying 50 of 78 results. So this first result right here for the Stephen Kelly, we can actually see that it actually gives us the address of which they have. And I can click on here for driving directions, a phone number, and underneath for all of the plans that are accepted by this as well. And so if you wanted to see what different plans can cover, we can actually see what all plans accept this specific provider as well. If you do click on more details, we can actually see that we can see the details such as, like if they're accepting new patients, if there's a patient age restriction, or if there are specialties as well. Also, if you do click on some of the more details, you can actually see if they do cover certain types of DME. Sorry about that. DME or transportation services. It actually says at the bottom on some of their specialties, it might say like medical supplies at the bottom whenever you click on the details. So if you do need help finding some of these or using the provider search portal, then you can actually go through the member services. And so each managed care has case managers that can provide information for members, like care coordination, special needs support, disabilities accommodations, chronic disease management programs, transportation, and even helping schedule appointments. So to find the more information, we can request a case manager from our MCO. And all of the managed care organizations, all their information is right here if you wanted to request that. It is for both medical and dental. So now I'm going to let Kevin talk about the upcoming enrollment.
All right, so we wanted to give you some information about some changes that are going to be happening to our enrollment process. As we'll mention, these changes are potential as there could be some updates to the actual content of the changes as these are still being reviewed. But what we're going to talk about today is what we intend to do, which would start on March 1st, 2026. So what's going to be new? Starting next year, March 1st, a member would be able to change plans up to 2 times per calendar year. Yeah, as you may be aware, if you've been enrolled in Medicaid previously or know someone enrolled in Medicaid previously, we've had an annual open enrollment period, and that was the only time that a member was allowed to change annually. We would do away with the annual enrollment period, and you would have the ability to change 2 times throughout the year. If the member makes those 2 changes, once they make the second change, then the member would become locked into their plan for the remainder of the calendar year. If they become locked in to their plan, you would still be able to request a plan change if you had a for-cause reason, which is what we do now outside of open enrollment. So that process would still remain in place. And for 2026, the period of the calendar year would be considered March 1st through December 31st. And then starting in 2027, it would run for the entire year, January 1st through December 31st. And as I mentioned, the exact start date and details are pending CMS and legislative review. All right. And so now Thea is going to go over some information that we have from some questions that were submitted that we did not include in the previous slides.
Yes, thank you. So yeah, we did have questions that were submitted, and we had about 3 questions that we were not able to fit in our demonstration that we had. So the first one was for durable medical equipment, so DME. So the question was, does Medicaid pay for DME equipment? As we saw earlier, if you wanted to search a provider or something that could supply DME equipment, we can actually go back to the provider to find the provider. We can follow the link, and then we can actually search just DME in the area, and then it will actually bring up the people who do offer those services. So Louisiana Medicaid does cover DME and define this Louisiana Medicaid, the DME provider. So beneficiaries should use the provider search tools for specific management for specific MCO that they were enrolled in. And if you do not, or if you do get confused, or if you cannot do it, remember then we can always go back to the case management for each of the MCOs that was and the phone numbers were listed earlier today. And then for transportation, so the question was, does Medicaid provide transportation services? And Medicaid does provide transportation services for members. And it's mainly a part of a non-emergency medical transportation benefit. So we could check with our managed care plan on the approved transportation services. And we can also check with our managed care, the case management services, if they can assist with those needs. And then once again, you can provide, or you can search those on the provider portal. And there is a transportation for non-emergency where you can search up the providers who do offer that. And there's also an ambulance as well. And then for out-of-state emergencies, Louisiana Medicaid covers those services deemed true medical services. So where your health would be endangered if care was delayed until you return to Louisiana. So Now we'd actually like to take over and ask if anybody has any questions, and we can check some of the chat.
Okay, guys, everybody understood the assignment. So there are definitely questions in the chat. Remember, as you include your questions, we want to be discerning about, any information that's in there that's personal. So I'll begin to read these, and bear with me. We have quite a few. If I missed your question, please just put it back in the chat for me. As a reminder, we are sending the PowerPoint out. I know some people were interested in getting information off of that. I'm going to get an updated copy and then send that before the end of the day. So someone did ask, and perhaps you covered this a little, who do I call about the adult disability dental for a dentist? And yeah.
So I would recommend we have an email address here on the last slide, this member linkage address. If they send us an email with that question, we can respond to that and give them the information specific to who they need to reach out to for that.
Fantastic. Okay. So the next question is about whether or not someone's child could go to other dentists outside of, I guess maybe it says outside of Shreveport. So maybe that's where they live. So could you get in with a provider that's out of your personal area, maybe? And please, if that's not correct, clarify that in the chat for me. I want to make sure we ask the correct question.
So they can see any provider that's enrolled in their adult, so in the dental plan that they are enrolled with. So the adult waiver program is provided by MCNA and DentaQuest. So they would need to see what providers there are that see that population in their specific plan, whether that be MCNA or DentaQuest, and they should be able to find a provider through those plans. Now, if they have a problem finding a provider, then they should reach out to their plan, because the dental plans also offer some case management assistance, so they can help you find a provider.
That's good to know. That's fantastic. Perfect. So next, I don't know I know that Kevin was fantastic in making sure there were a lot of people on the call to answer any questions that might come up. So we're going to do our best to do that. But in lieu of that, the next question is about whether or not the Healthy Louisiana plans still have autism case managers, specifically for individuals with an autism diagnosis. Do you know about that, Kevin or Theo?
I do not know the answer to that question. And I see that's Karen, who's I've worked with her before. And if she can send us that, we can get her an answer for that.
Perfect. Okay, so let's see. We are going to make the slides available. So there's a professional in the chat that's stating that they assist with Medicaid updates, renewals, and applications, and they often have trouble getting someone on the phone for a status check, an update, or a reason if denied, etc. Do you have a direct number for individuals who are working with families to reach out to? She says that also several times, once completing applications and uploading income to my Medicaid, workers state they did not receive, so the case closes. And at that point, they have to go through another process to see about coverage. Is there a quicker way to get results in a situation like that? What's the protocol, or is that something that needs to be sent?
Yeah, I would advise maybe send that scenario to us in an email, because we do not work specifically in the eligibility area.
Gotcha.
But we work with them, and we can get some information on that if there is something that can be done there. And if specifically you can provide, what type of agency you're with, that would be helpful so we could find out if there is some type of direct contact that can be provided to the type of agency that you're with.
Fantastic. Okay. What information is being provided to ensure individuals and families understand that if they change their plan, any prior authorizations for services such as speech, OT, PT, and ABA that are renewed quarterly would have to be redone immediately upon change? This has been an issue for providers who were not made aware of the date of the change in coverage and who continued to operate under a prior authorization that was no longer valid. This is also an issue for families who are hit with bills for unpaid services when it happens. Any suggestions there?
Give me 1 second. I'm reading the question.
Okay, I'm sorry.
No, it's okay. It's okay. So I would want to get back with you, and I see that's also from Karen, to get that information, because I know that some of that information does, the plans have to honor certain authorizations that do transfer when the member has continuous eligibility and transfer plans. But I would want to double check that
Yeah.
and provide that, make sure that we have all of the information for her.
Correct. So like that's the hard part sometimes is there are lots of people involved in these processes. So by giving you a way to get more information, understand that that's going to be helpful. Maybe not in this minute, but you'll be able to get some information to help. So thank you for being understanding as we work through these. So do you have information to be able to discuss the Act 421 Medicaid application?
We're not familiar with that application. Again, that would be more on the eligibility side.
Gotcha.
But we can get that and provide it and provide some information about it.
Okay, perfect. How does one find a for-cause disenrollment request? A family was not able to change their dental plan this year and they weren't able to get much help.
So they can either go to the My Plan website and either contact the phone number there on that website and request to change plans through that method. They would assist you with that in submitting that request, but there is also a member portal on the My Plan website where you can submit that for-cause disenrollment request. Or again, you can send us an email with your specific information and we can look into that denial to see what happened there.
Thank you, Kevin. Are you able to speak about dual enrollment at all?
It would depend on the topic.
Okay.
There could be some questions that we would know the answer to. There
Sure.
would be some that we might not
Right.
know the answer to.
I gotcha. Feel free to provide maybe a little bit more information in the chat if you'd like. Otherwise, I would think maybe you could reach out to that email address with your concerns, if nothing else. So can you speak to whether or not Medicaid would provide transportation for someone to shop for winter clothes? I know that I had heard at one time there was a value added benefit of like some expanded transportation. So that might be specific to like the plan. Can you speak to that, Kevin?
Right. And we would have to take that back because, we're some of that more benefit specific
Right.
information we don't have, but we can
Sure.
definitely go to the transportation team and check on that.
And I would maybe recommend to reaching out to this specific managed care plan.
Correct.
I know that I've heard now, it's been probably 6 or 9 months now, but I had heard about some expanded transportation options as a value added benefit, not as like that core service. Um, Case management may be able to talk to you about that, or someone with the plan specifically. So there's a question about out of state specialized care that's not provided in Louisiana, specifically for rare genetic disorders. Um, can you speak to whether or not that's something someone could access?
Yeah, we wouldn't be aware of that. The information that we provided, sorry, give me 1 second.
Yeah.
So I'd recommend either contacting the MCO to see if there's any potential coverage there. But yeah, as we
I was
mentioned,
wondering if it related to that as well, Kevin. Thank you.
right. Um, it, coverage is only provided if it's considered a true medical emergency. But again, if there's more information needed, we can reach out to program staff and ask about that.
And that might be another case where I'd contact my plan and speak
Right.
to someone in case management to see, whether or not there's information that's just not applicable to like most, and see what kind of information you can get that way. So it sounds like pertaining to the individual that was asking about seeing a dentist outside of their area, I think the answer is the same, but they were asking if, and I know this is your background, Kevin, whether or not that applies also to someone who is on the now waiver looking for a dentist. Like, can they also still see whomever so long as it's covered by that particular plan, if I understand this correctly?
Right, as long as it's within the state.
Yes. Okay.
So yeah, with Shreveport obviously being closer to several other states, you
Sure.
would just want to make sure that you would be staying within Louisiana and then within your network.
Perfect. Okay, so more specific about dual enrollment. Does dual enrollment affect long-term Medicaid and now waiver services? Do you know um, if that's the case?
That one I'm not sure of.
Perfect. That works. Thank you as participants, guys, for being patient. Thank you, Kevin, for being patient with me I'm sure you're scrolling through these as well. Some things cannot be answered by these staff, and that is okay. You're welcome to call our office. Let's talk through. And like I said, they provided this email address as well, to direct questions to. You're welcome to call our office too to see if that's something we can work through. An email address for specific questions. Now waiver, extensive dental require hospital instead of an office stay. So I'm not sure I understand that. Is this information maybe that someone could get by emailing the member linkage at la.gov, Kevin? I don't know if you understand that differently maybe than I do.
So for dental related questions, they can send that email to that address, yes, and
Okay,
we'll pass anything that we need to on to the current dental team as well.
perfect. So an individual says they help individuals who are often concerned that their income could impact their Medicaid benefits. What's the monthly income limit that does not impact Medicaid benefits? I think that's probably also maybe for eligibility. eligibility team. And
And
you
that
can
age
probably,
varies depending on the program, and there are certain other circumstances that could impact that. Uh, so I mean, we can get an answer for that, but we don't have that.
gotcha. So, Carrie, that's also probably something that you can get more information about by reaching out to your local Families Helping Families office. I know that there are groups that help do benefit management type things for families. Um, so, Kevin is saying that this member linkage could be a resource to you. You could call us as well. Uh, let's see. Can you speak to examples of what the transportation benefit covers? That may be for someone else
So
as well.
yeah, for the most part, we know it's any provides transportation to anything that the plan, that's a covered Medicaid service. So doctor's appointments, wellness visits, to get medication. There could be some other benefits in there, especially like you mentioned, if there's value added coverage. So I would recommend, um, speaking with your plan for any specifics.
Perfect. Let's see. I think we got this question, but I could be wrong. How does dual enrollment affect now waiver recipients?
Right, and I think that's similar to the one that we just said we
Yes. Okay.
weren't
That's
sure
what I
on.
thought. I'm scrolling and I don't have a way to check what I've looked at and what I haven't. I'm so sorry. So who's the contact person for assisting someone who needs help accessing chiropractor care using legacy Medicaid as a secondary? The provider takes the MCO plans, but not legacy. The provider does not know how to do that, even after contacting the provider, whomever it is, providers contact when they need help. Client is paying with their primary because of this. Oh, um, does that make
Yeah,
sense, Kevin, or is that?
I'm taking a look at it to
I
see.
gotcha.
So the provider, if the provider wants to enroll with Legacy Medicaid, they can go to lamedicaid.com and start the process of enrolling with Legacy Medicaid. And that's with our fiscal intermediary Gainwell, if I'm understanding that right, because it sounds like it says the provider does not know how to do that. Um, so that makes me think that the provider might be willing to enroll. Um, so if the provider is willing to enroll, then they can uh, go to that lamedicaid.com website, and there's phone numbers on there for provider enrollment. And they can reach out to Gainwell if they need assistance with the application process, and they'll walk them through that.
So there was a follow-up question to that about like what you would tell the family. I would think, like Kevin said, if the provider is interested in enrolling, then you would direct the provider as a family. You could recommend that the provider reach out to Gainwell, is what it sounds like. Because at that point, I don't know if if the family could maybe advocate um, with their plan for legacy Medicaid's a little different. They could maybe
Well,
advocate.
and the only other option, if they're assuming, since they're in Legacy Medicaid, that they're enrolled in a waiver, then they would be voluntary, so they would have the opportunity to enroll
Right.
with an MCO, but there may be other reasons why they're in legacy.
Yeah.
So that's a possibility to consider,
Right.
if, there would be, if the opportunity, and the value is there more with the MCO, given this situation.
That is a caveat. I'm glad you pointed that out. That's true. That maybe makes it a little different. What is the difference between Medicaid and long-term Medicaid? And when do you need them? Is that
So I'm not sure if that's referring to long-term care, which would be, if someone's in a nursing facility. Uh, that's the only use of long-term that I'm familiar with.
okay? So, one of the questions is, did I understand enhanced Medicaid might cover transportation to a variety of places? Um,
So there may be some value adds.
right.
So for that, you would want to look at the value added chart. I'm not sure if it's on there, but you can check with the MCOs to see, if they have any additional transportation benefits. Um, they may not. So before you attempt to book any services, be sure and check with your MCO.
Sure. Yeah, that's wise. Um, and for a family in general, when they run into problems using legacy Medicaid, providers don't really seem to know anything about it. Um, so providers don't seem like providers also have questions about legacy Medicaid, or maybe I'm reading that. Do you maybe understand that question? I might have
So
that
if the
that statement.
provider is enrolled in Legacy Medicaid, then they can also go to that LA Medicaid website and reach out to Gainwell, because Gainwell does have, some numbers on there to assist providers, in that process, not only for provider enrollment, but provider relations in general. And I know there's a provider relations at la.gov email address that if they're having issues with billing or anything like that, they can reach out to that email address as well. And again, that was provider relations at la.gov. Um, and any questions that they may have, like if they're having issues with billing for legacy Medicaid.
So I thank you, Karen, for pointing out dual eligible individuals are voluntary in legacy only if they don't also have Medicare. That's helpful information. I'm going to add the provider relations at la.gov to the chat. Hopefully that's correct. Um, so a good question here, is there a way to compare legacy versus an MCO?
I'm not
So I know
aware
that you
of,
can compare the MCOs, but
right, and I'm not aware of any. I know it's not on our My Plan website that we have, a specific comparison. It's definitely not on our compare plans page, anything with legacy. Um, and I'm not aware of any prepared, yeah, flyer or anything that directly compares the two. Uh, so I don't think we have any educational information that specifically would cover that.
yeah. Okay, so is there a specific list of case managers to contact for assistance with dental services that require hospital or coordination for both MCNA and DentaQuest, respectively?
And for that, you just have to contact the specific dental plan.
Okay, that's kind of what I was thinking. And Karen said long-term care is nursing home and waivers. Um, okay, so she was asking what a family does when they need help, not a provider. So I would think that in that case, you would go directly to your managed care plan. Is that accurate?
Right, was this the one with the question about the legacy Medicaid
This,
provider?
I'm
Yes.
going to, uh, Medicaid providers don't seem to know. Yes. Yeah, you're right. I think it is.
So
Is
I
there case
would
management through, Legacy, Kevin? I don't know
I
that
would
that's a,
advise to send us an email on the case and let us take a
okay.
look at it.
For more specifics. Yeah, that makes
Right.
sense. Um, People who live in their homes also have legacy long-term care, Medicaid, and now waivers, not just okay. So that's maybe for clarification. Um, so Karen suggested that to compare legacy with an MCO, there's a legacy provider search engine. Yes, I've used that. That's helpful. On the Louisiana Medicaid website that people can see if their doctors are in there. Yeah, that's good information. Um, If long term is waivers, then regular Medicaid are for those who don't need waivers. That's maybe a little specific. Which email to contact for further information about subjects mentioned today? And they're basically saying thank you for the information. So for any of those, it sounds like for any of those questions that maybe did not get answered, I guess Kevin, does member linkage kind of like funnel things,
That's
maybe?
well, that's our general email account for our
Gotcha.
enrollment broker section, and we can send anything out we need to, or ask other areas questions if we need to, or
Fantastic.
do research that we need to.
Yeah. So anything that's not plan specific, it sounds like you could definitely send to member linkage at la.gov. Again, you'll get a copy of this presentation, so you'll have access to that. I will type it into the chat as well so that you can copy it if that would be helpful. Um, this is your time, guys. If you have any other questions, Kevin, thank you for helping to facilitate those. I know that they don't all apply to the information that was presented, or some things are just require a different department, maybe even. But the changes are really useful to have, like that information as those things get approved. Understanding how you can compare plans so that you can make the right decision for your family, also super helpful information. So you'll get this before the end of the day today, this presentation and the links and such. Um, yes, we
If you don't
appreciate you
mind
being
me,
here.
if you don't mind, I just want to thank you for having us.
No, we
And
appreciate you being here.
and I did want to say one thing I don't think that we mentioned. So on November 20th, the notice of intent, the for the rulemaking with regards to those enrollment changes that we mentioned will be published. So it'll be out there for public comment at that time,
Good.
the Louisiana Registrar. So you can be on the lookout at that if you want to see, the exact language and provide any comments or questions that you have at that time as well. But
Fantastic.
again, thank you everyone for having us here today.
No, we appreciate you. Um, okay, guys, I'd say you have like 2 or 3 more minutes if you have questions you'd like to get in. Um, we'll kind of hang around for just a few minutes. I definitely want to express my gratitude again to both Kevin and Theo. They had additional team members who were here specifically to provide information if they could to different questions. So I'm grateful to those individuals. Um, Time is valuable. It's a valuable resource, guys. So uh, to have someone that can answer some of these questions and then kind of prepare you for what's coming has been a great resource. So lots of thanks in the chat, Kevin. Okay. Well, there is a short survey after this presentation. It should go directly to that when you end and when you leave. So if you'll share any information there, questions, comments, if you have any recommendations for other trainings, please let us know that as well. Yeah, I know it's hard when you're trying to reach out for answers. It's difficult. Utilize the member linkage at la.gov and see if that works. Call us if you get stuck so that we can maybe try to help you work on that to get the information that you need. Perhaps it's a question that we can help answer even. But yes, please fill out the survey. I'm grateful again to Kevin and Theo and their team. We were happy to have you guys today. Please let us know if there's anything else you have questions with, and we'll get the PowerPoint out to you soon.